Harvard Business School professor of management practice Rob Kaplan recently received an invitation from Dr. Paul Farmer, a much-honored physician who heads Partners in Health, to visit Haiti. Rob is here with us today to tell us about what he accomplished during his visit. Rob, thanks for talking with us today.
Good to be here. And
what did Dr. Farmer want you to do?
Well, I'm on the board of the medical school, and I'm actually on Paul's global health advisory board. And so we've got 6,000 employees at Partners in Health in Haiti. They're a very large employer, very complex operation. And so Paul has been wanting to teach leadership and help with a number of management issues among his leadership teams. So what I did is we worked together and designed a leadership program to be taught that was really designed for what they're doing. And it was heavily based on normally what I talk to leaders about: vision, priorities, alignment, and giving them a number of practical ways to go back to their office and do what they need to do. And so he took the top 100 leaders, and we did a full day session, and then we did a separate session for his top 15 leaders. And so I'm looking forward to going back again and following up, and we'll do this for a broader group. But I think it got them rolling, and I was glad to do it.
Now, this is the second anniversary of the earthquake. What's your take on the state of the island and its people at this point?
Well, it's difficult. The first thing you look at is GNP per capita in Haiti is around $500, and you can see when you were there what that feels like. There's still an enormous amount of damage from the earthquake. There's been some rebuilding. Presidential Palace is still destroyed, but there's a large number of people living in tents, children that have been abandoned, health-related problems, still a high incidence of tuberculosis. There is a fear of a cholera epidemic in the country. And
another cholera epidemic.
Yeah, and so there is... There really is, I wouldn't call it desperate, but it's a very difficult situation with people trying to figure out how to eat and survive, and the government working hard with a new president to try to work on rebuilding the country. And Partners in Health plays a very central role, along with the UN, Clinton Global Initiative, and others in trying to make that happen. So I think all of us at Harvard, and I certainly feel this way, should be very proud of Paul Farmer, the leadership group, and the work that Harvard is helping to do through Partners in Health in Haiti. It really is making a huge impact in that country. Now, Partners in Health also works in 15 countries generally, Rwanda, others. So they're really doing the same service around the world. Haiti is just a very pressing and difficult situation, but it just shows the power of what Harvard can do, to me.
Now, as I understand it, Partners in Health is working on a new hospital for Haiti.
Yes, in fact, it's going to be ready in March. We went through it. I met a lot of the volunteer construction workers, many of them from Boston, but from all over the country, who are working around the clock to get that hospital ready. That will be a huge change. This is about an hour outside Port-au-Prince in Mirabel, and it will make a huge impact on the community there, where they actually will have capacity to serve more patients, which is a critical issue there.
So do you see some sort of hope, some light at the end of the tunnel, if you will, in Haiti going forward?
Sure, absolutely. I mentioned there's a new president. There's a lot of work that many agencies are doing, but it's going to take time, and it's going to take continued focus, and it's going to take the continued efforts of Partners in Health to keep doing what it's doing. But a lot of it involves also training, teaching. This is where Harvard comes in. The problems aren't going to be solved in the long run by people coming in from outside. It's going to be people coming in and teaching people who plan to live there, Haitians, how to care for patients, how to manage, how to rebuild, and all that involves management and leadership training. And so I think it's very critical to teach them to do this and help them learn.